Allergic eye disease is very common. It's often in two sort of peaks if we look at an age distribution. So children get a form of allergic eye disease known as vernal keratoconjunctivitis, and adults get a form known as atopic or allergic conjunctivitis. And you don't have to have had it previously. It can suddenly just come on, and we're not sure why. It could be that there's an aggravating insult. For example, you get you suddenly get an allergy to a cat in the same way as you get allergic to peanuts, whereas you've never had them before, and that's known as sensitization to an allergen. Allergic eye disease is often related to a history of hay fever, asthma, eczema. Hay fever is a form of seasonal allergic conjunctivitis, so it basically occurs just in that season, spring or summer. But on the whole, the diseases that we look after tend to go across the whole year, so they can be in winter time, and patients are often debilitated all throughout the year. So this is known as perennial allergic conjunctivitis. And there are several forms of treatment. Initially what we do is we work on the immune system preventing an acute response. So we use antihistamine drops as a first treatment. This takes about a month for us to settle the eyes down. Often they're accompanied by a short course of steroid treatment, steroid drops. If the eyes still don't settle, and we usually give it about 1 or 2 months, then we will consider using another anti-inflammatory, and that's often cyclosporin drops. In children who have vernal keratoconjunctivitis, or VKC as it's commonly called, there is now a licensed product available for them, and that's only recently come about in the last month or two. It's basically been trialled across Europe and is known to reduce the requirement of steroid drops in children. We don't like using steroid drops on a long-term basis in this disease, and the reason for that is that it has complications, so you can get cataract formation and glaucoma, both of which can affect your vision long-term and permanently. So if we look at allergic eye disease, we've treated them with antihistamines, we've used anti-inflammatories in the form of cyclosporin. If it's still no better, we will then consider tablet forms of treatment, and in severer forms, where it's related to severe eczema, hand or facial eczema, we will then consider using immune suppressive treatment in the form of tablets. So there is a big step difference. We are currently trialling a new first-in-human treatment, and that's a trial that's just started, which will fill the gap between exhausting all the drop forms of treatment and the tablets, because obviously going into a treatment that's going to suppress your immune system is quite an aggressive form of treatment, and if we can find something in between, then that would be ideal. But there is a gap in that step ladder of treatment, and we're working on that.